Thanks for tuning in to another episode of Street Level with Chris Chermak. I hope you enjoyed last week's episode with Carl Beardsley, where we discussed all things AVP. I thought it was great. Today, Gus Fahey from Valley in Motion. So we're going to find out what that is, and we're going to hear all about it. So here's Gus. All right, Gus Fahey from Valley in Motion.
That's right.
Before we talk about Valley in Motion, why don't you tell us about yourself and how you got into this?
Absolutely, yeah. Well, I'm a Scranton boy, born and raised here. I left for about 25 years, did various things, including worked at FEMA, Federal Emergency Management Agency, during 9/11, and then worked for the State Department after that.
Okay.
So for 8 years, I was doing a variety of things, from human rights advocacy, especially religious freedom, to representing our country in our relationships with Nigeria, which is the largest African country, to running big peacekeeping and military reform programs. So I had these wonderful sort of life experiences, and in 2014, after we had kids, moved back here for the family support and for the much easier living.
Yeah. Now, and if I remember right, your father, teacher at
the University of Scranton.
That's right.
For over 50 years.
That's right. Okay. Yeah. Yep. Awesome. Well, great. Well, it's great to have you on. I appreciate you coming.
Sure.
And I'm interested to hear about Valley in Motion. So tell us a little about the initiative, Valley in Motion.
Sure. Yeah. It's a great nonprofit that's focused on community building and quality of life in the Lackawanna Valley. So we're really interested in what are those things that make our place a great place to live. And what are those things about the community that are strong, and what are those things that we really need to strengthen? So we looked at, so we do a variety of initiatives. Some of them are about building up physical infrastructure. So we have this project around the iron furnaces to develop that area that's right in front of there. So it's a better corridor for walking and biking and bringing people to this great historic resource that's there. We have community design projects that we're doing, and then mural projects, to sort of enliven our downtown centers, or to bring people to different areas.
Right. And I think the county was involved in some of the mural.
Up in Carbondale. Yeah, we're having our grand opening June 5th. We haven't painted the mural yet, but that's on sort of, we're going to be doing that in May.
Right. So the weather's been a little iffy.
Yeah, you can't really do it during the winter.
Oh.
But yeah, we take these physical projects and then combine them with what we feel like these sort of attitude changes that have to happen in our area. So for people to feel like they want to contribute, that they come from a good place, and that they're part of decisions that affect their lives. So that's the theory sort of behind our work, that we not only do good works, but we try to tie them together in this common narrative of progress and pride, and making you feel like that this is a place where you can make a difference.
Yeah. Now, who started Valley in Motion? Was that you that started this, or
no? It was started in 2008.
Okay.
By the people who ran the Lackawanna Heritage Valley Authority.
Okay.
So that's a municipal authority, but the leaders at that time started a nonprofit to support what LHVA, Lackawanna Heritage Valley Authority, was doing at the time. And so it was mostly to support the cultural and heritage projects of the authority. And eventually we sort of grew to thinking that we want to support more organizations that are out there. So I joined at the end of 2019, and we end up rebranding and changing our name to Valley in Motion to sort of reflect this wider mission that we now have.
Right. Well, this is perfect timing because every day I go home from work, I see your billboard on the
Right.
expressway,
Thank you.
and I saw the article, and you made the front cover of Happenings magazine. So
That's right.
yeah, so this is all good. It just happened
Yeah.
to work out this way, so
Yeah.
it's
Yeah.
all good.
Absolutely.
So we have the murals going up.
Hmm.
Is there any other mural projects that are in progress, or
Yeah.
what's?
So we're working with Forest City, which is right over the border from Lackawanna County,
Yeah,
but still
yeah,
in the Lackawanna Valley. And so what we bring to it is sort of we help to bring the people together. So we have these good connections with mural artists,
yeah.
and then we help municipalities sort of raise the money and then run the project themselves.
Okay.
So we're sort of filling this gap where we collect the partnerships so we make sure that these projects
Yeah,
happen.
we'll follow all the way through.
Yeah,
Definitely.
yeah,
Well, that's cool. Good.
yeah.
Well, I look forward to seeing some of these in progress this summer.
Yeah,
And then you talked about iron furnaces. So
right.
what's going on that you guys are working on to try to improve there?
Yeah, a few years ago, architect Michelle Dempsey made this whole vision for that area and how it could be transformed so there could be this intersection between South Scranton and the downtown, and then the University of Scranton and the Lackawanna River and the trails, and then even extending up to Naog Park so that you have this, it's at this intersection of all of these walking and biking and recreation activities. And at that time, there were a lot of stakeholders that were bought into it. A lot of people were talked to about
Right.
improving the plan, but it never went anywhere because there was never an entity to sort of pick up and say, I'm going to be the one responsible for getting the grant money to make this happen, for running the contracts to make sure the work happens. And so we have now taken on that responsibility to put it all together. And so we just applied for our first round of grant funding in September of last year, and we're hoping that these programs can come to fruition.
Yeah.
Because really making that whole area there, that is like the heart of where Scranton started, to make that come to life, so that people can use it and appreciate it, and it have be a useful space, which right now is kind of a dead space.
Yeah.
That it could be a model for how we take other underutilized spaces in our area
Yeah.
and give them new meaning.
Well, the iron furnaces, I was looking forward to some things going last summer, and then that got squashed, obviously.
Right,
So
right.
I'm hoping that we're on our way out of this mess, and
Yeah.
we can start to enjoy some of these things that we have at our fingertips here.
Right.
Well, that's
right.
good. How do people get involved if they want to get involved?
Well, I mean, you go to our website, valleyinmotion.org. We have a Get Involved
Okay.
page. So there's ways to volunteer, to sign up. The biggest initiative that we have going on right now is something called Blue Zones.
Right.
And so this is a really good and easy way to get involved right now. But
So what's a blue zone?
Yeah,
Let's
yeah.
start with that. That's my
what
question.
the heck is a blue zone? Yeah. Blue zones are areas of the world of exceptional health and wellness. And people are living to 100 years old and living good lives at that age at rates that are 3 times the US rate. And so National Geographic at some point said, like, what is going on with these places? Why why are they living so long? Why are they so happy?
Yeah. Yeah.
And what they found, has less to do with, say, healthcare. It has less to do with people running marathons or people being super disciplined about
Yeah.
what they eat or any of that. And that so much of it comes down to the environment that they live in. And that environment includes, being able to walk to places you need to go, like, the farm stand, or walk to your family or your friends or your religious organization. Like, and that the people, because of culture, are eating foods that are good for them. Like, that part of the culture is strong. And the part of the culture that says people at all stages of life have an important role to play. that's an important part of the culture as well. So it's not like our value is tied to our work life, and then when we retire, like we just don't have anything to add.
Yeah.
Like, no, that's not in the case. Like elders are treated like they have a very important role to play in the religious and the cultural passing on of traditions and advice.
Kind of things that we maybe did years ago,
Well,
kind of forgot about.
Yeah.
Good living.
Yeah.
And,
Well, Chris, this is what I find like extremely interesting, because the way that our towns were laid out originally, like that's kind of the way it was. You know, you you stuck to just a small area and you got everything done that you needed to do. You know, you did all your shopping within walking distance, or you went to school, walking. And so like we've spent decades and billions of dollars sort of spreading everything out, of separating where we live to where we shop, to where we work, to where we go to school. And, and now we're sort of finding out that maybe the old way we did it, had some merit.
Yeah, a little less stress in our worlds back then.
Yeah, less stress and more time. So that to me is the ironic thing. Like we live in a car-centric culture and we have less time. We have all these devices to speed up and make things easier, and we have less time. It's just crazy.
Well, and now on my notes here, I have community well-being measured through a unique 77-question survey.
Yeah.
Expand on that.
Sure. Well, so when I sort of first came into Valley in Motion and we said we're going to improve quality of life, I did monitoring and evaluation of programs when I was at the State Department. I said, well, what the hell is quality of life? How we can know whether we're being successful or not. And it turns out there already is this measure out there. Millions of surveys across the U.S. are measuring this thing called community well-being. And so we just had to tap into it and see what our rating was, and then see what we need to do to sort of, improve that rating. And so for our area, the Scranton metro area, which is it's a large area, includes not only Lackawanna, but Luzerne and Wyoming counties. There's 5 things they look at: community, social, purpose, financial, and physical. And so of these 5 ratings, the social aspect, our area did great. So we have we're well supportive. We have love in our lives. Like socially, we're in the top 3 of metro areas around the country. And here's the killer. For community, we were like almost at the bottom. And community measures, do you like where you live?
Yeah.
Do you feel safe? Do you have pride in your community? So it's a really weird conundrum where we like the people that we live with and we don't like where we live.
Yeah. I don't hear it so much like I used to, like when I graduated. You hear like, well, I got to get out of here.
Exactly, yeah.
Well, we're not hearing that so much. And we have so much to offer in this region, and we're so close to everything else anyway.
Yeah.
But it's a different world now. What are the strengths in our area? What do we need to work on here?
Yeah, so I think first of all, we have to acknowledge that, maybe I'm starting with myself. Like I have to acknowledge that even though I think this is a great place to live, if I look at these surveys, other people are not saying that. So we have to address that in some way. And that's why I think just sort of reinforcing those things that are good, like that helps to turn the narrative, and focusing on things that are different from our coal mining days, like to make that break and be known for something different. Like I think that'll all help. So it is this sort of bending of the narrative. How do we talk about ourselves? How do we think about ourselves? That's really important. And it starts with each individual one of us. And we're the ambassador, and we have this influence around people that we've known all our lives, but then other people coming in that like the area, let's not rain on their parade. Let's support that and let's welcome new people so that they feel like they're just about part of this community as much as I feel like. Even though I was gone for almost 25 years, I still feel like, I belong.
It's home.
Yeah.
Well, years ago when I first decided I was going to run for county commissioner, I was frustrated, and I saw what was going on, and lot of unprofessionalism and a lot of things go that I thought could be done so much better.
Mhm.
And those are things I thought about. So, well, I have a couple choices. I could ignore it,
Right.
or I could move and go somewhere else, or I could jump in and maybe try to make it better.
Right.
Well, that's what I tried to do. So,
Well, can I add to that? Like, this is a place where you can make a difference.
yes, it is.
And here, like my wife and I, we're living in Washington, D.C., the nation's capital, the most powerful country in the world. And yet, when I move back home, here's where I feel like I can make a difference. Because all you have to do is show up and you can start having an impact. People start listening to you, know, and that doesn't happen all over.
And we have a good support system here. People want to get involved. Sometimes they just need that push.
Right.
And I talk about this before in a couple of the episodes that I've had. Where can you, I like to go for a walk in the afternoon after lunch or something around town.
Right.
Well, I say hello to 25 people just in 5 or 20 minutes.
Right. Right.
That doesn't happen in Washington, D.C. or
certainly
New York
doesn't.
City. You don't see people, I mean, maybe,
know.
but so it's a different world.
Right.
But we're growing here. The city's improving.
Right.
We have a lot of industry coming in, and we have the new can pack facility. So there's going to be a lot more people coming to our region.
Right.
So this stuff's going to be important.
Yeah.
You know?
Yeah. And so for new people coming in too, I think we also want to make sure that we're welcoming to them as well. And so what are their needs? And then how are we like helping to fulfill that? And for me, like part of it is it's the social capital. It's those people that I mean, we're still a community that kind of runs on that.
Yeah.
So the new neighbor that comes in, let them tap into that network as well by, being a friend of yours.
Yeah.
Well,
and coming out of the pandemic, we're starting to, I could say more than see the light at the end of the tunnel. I think we're almost there. Yeah. And this is going to be like a new day this spring and summer. Right. So between coming out of the pandemic, people's been tied up for a year. You can't do anything, can't go anywhere.
Right.
So hopefully we can get back to going to the trolley museum and going to the coal mine tour and going to the iron furnaces and just getting out
together with people.
Yeah. So
well, that's one of the reasons that I like this Blue Zone project, because COVID really did expose a lot of our vulnerabilities. And so I do think, and our community came together great in terms of the emergency response, especially the food banks and all those things that helped people with their immediate need. But I also think that having a longer term vision about how we build a more resilient community that's able to withstand this kind of thing, I think we need that as well. And so that's what this program is. And it's not just Valley in Motion, but we're leading this coalition of healthcare organizations, employers, foundations. All of us sort of have this interest in having a healthier, stronger community. And more equitable as well, like more equitable access to recreation or healthy foods. Like that takes policies and that takes infrastructure. The bike lane or the improved sidewalks, that really helps people get along. Yeah. And it reduces your expenses too. If all of a sudden you don't need a second car, that your family can walk downtown or to get to the services or, the services, shops, food, whatever that you need, then, everybody's better off. Yeah. People are then more able to afford to buy a home, which is very affordable in our area too. So I can see how all of this stuff sort of bubbles up to make for a stronger foundation.
Well, it's good for mind and body, but I noticed on the website when I was looking at yours about the savings in healthcare.
Right.
When there's these things are up and running.
They're massive.
Like
they're massive.
I have it written here, $952 million could be saved.
Yeah. Over 10 years. So that's just bending the curve. So our healthcare costs are going up.
Yeah.
And so that's just bending the curve a little bit. And if you reduce smoking 6% or so, and we have a high smoking rate in this area, if you can just change the attitudes and behaviors about that, like in Fort Worth, I just read this today. In Fort Worth, they reduced their smoking rate 6%. That saved them $262 million every year. I mean, Fort Worth is a big area, but that just shows you how just small changes then. So it saves them medical costs, unnecessary medical costs. It's productivity. So it's not only, if you're unhealthy, then you might have more sick days. But also if you're more connected to your community, if you have a stronger social network, if you have a strong sense of purpose, what these surveys show is that you as an employee are more resilient, are more adaptable to change.
Yeah.
And with the industries changing, so rapidly and all the time, that's the kind of workforce that we need as well. So it's interesting the way these things work. And then also what these studies have found is that if the less money you're spending on unnecessary medical costs, the more you're just putting back into the local economy.
Right.
So it's got this wider regional economic impact as well.
Now you have there are some foundations in here. I see Moses Taylor Foundation's involved.
Yep.
And Share Care. What's Share Care?
Yeah.
I don't know what that is.
Well, Share Care is the healthcare organization that's actually helping us do this. So there are consultants for bringing these programs into this area.
Oh, okay.
So they have this partnership with Blue Zones LLC, and they're the implementer of these types of programs. So they helped us do the analysis of first. They're the ones that do the community well-being surveys in the first place, and they have sort of advanced stats, looking at social determinants of health statistics. They can really tell us what are, based on our strengths and opportunities and looking at the data, where are the areas that are going to have the most impact, and where should we really focus our areas?
Okay.
So, yeah.
Who else is involved? Is there anybody else besides Moses Taylor Foundation?
Mm-hmm. Geisinger, Highmark, Lehigh Valley Health Network, the Wright Center, AmeriHealth Caritas. So we have an exploratory committee that also concerned. I have, Lackawanna County officials are on there. Scranton Area Foundation, Allied Services Foundation. So there's just a wide variety of players. VaxServe, the vaccine maker. So they're all involved in helping get this program off the ground. And we're at this critical next step that when we talk about how to get involved, I've got a really good avenue for you.
Okay.
So our next step is doing this community site assessment where we talk to just a ton of people about what we need to do for better community well-being. And it could be about food policy, could be about neighborhood engagement, could be about schools, work sites, public policy, but it's an opportunity before we design these programs, we want to go through this big community input process so that people have an opportunity to weigh in on them. And so, so we have this website set up now, go.bluezonesproject.com/NEPA. And you just, you go there and you can sign up, but we'll be sort of broadcasting that opportunity to sign up, in the coming weeks.
Yeah.
Yeah.
Okay. That's awesome stuff.
Yeah.
So between what you're trying to do with Blue Zones, we have our trails now that are, they're growing. And sometimes you can't even get a parking spot next to some of these things. So everybody's using it, hiking and biking and cross-country skiing this year with all the snow.
Right.
You doing anything if people want to do gardens for different groups? Are you doing anything like that?
Right. Well, so as part of these Blue Zone programs, it comes down to the programs are split up into people, places, and policies. But the people part is really important because what we found is that getting people together in small groups, that there's small group dynamics about attitudes and behaviors that really reinforce one another. So you might get together. So as part of this, you pull together walking clubs. Okay, we're all going to meet at the trail at this time on a Saturday and walk, or lunchtime. Cooking clubs. What's healthy foods that that's not really what our family recipes used to make, but are appropriate for the jobs we do now, where we're sitting down all the time.
Yeah.
But gardening clubs, I've heard that's also a very effective way to do that too, because gardening, that's one of the key characteristics of blue zones. So as I said, like people aren't crazy exercises in blue zones.
Right.
They don't lift, they don't run marathons, but their daily life is full of movement. So gardening is like a key similarity across these areas, because it's exercise, but not in the way that we're used to thinking about it.
Yeah.
There's this constant movement. You're not really sitting down. And then, the fruits of your labor are delicious, nutrient-dense food that's, hasn't traveled anywhere before it's got to you.
Right.
Yeah.
Well, I know in the Abingtons, there's by the senior center, there's a big community garden there, which,
Right.
I know that's pretty popular.
Yeah.
So hopefully they start to appear a little bit more.
Yeah.
Who pays for all this stuff?
Right. This is a lot. So, I said about like the savings that comes to that.
Yeah.
So who realizes most of those savings? It's really our healthcare plans that are incentivized for stronger community health. So that's why we're engaging, all those players that I was talking about, because in blue zones communities across the nation, there's usually an entity like ours, or sometimes it's a government agency that sort of pulls it all together. But the price tag for these things, it goes to those that are benefiting the most. So typically it's either it's hospital systems, but it's more likely to be insurers, so health insurers, because they're the ones that save money if you have a healthier population. But it's also employers as well. So they've often pitched into these programs. If you can, once again, it's about it's showing that return on investment.
Yeah.
And if you can demonstrate that you have HR policies that have these kind of wellness things built into them, and that equates into either higher productivity or less turnover, or happier workforce.
Well, sure. You improve quality of life. It helps everybody.
Right. Yeah. So higher quality of life means that businesses here are more successful, and that it attracts also new businesses. Okay. So I keep on hearing that as well, that like the trail is something that all of a sudden is a relatively new thing on our landscape. Yep. That we point to that when new businesses are moving into there. So yeah.
Definitely. Mm-hmm. And that's stuff that, my brother lives down near Baltimore, and they had trail systems and stuff. They've had them for years.
Right.
And everybody utilizes them. And when they started doing it here, it's like, wow, we have all that discarded proper land, or tracks of the old railroad beds and stuff.
Right.
It was perfect.
Right.
So I think it's great.
Good.
What else could we talk about? Anything else you'd like to add to blue zones? We touched on a lot of things.
Yeah. So, we're just looking forward to that project coming to fruition. It takes a whole bunch of people. So there's sort of this organizing effort that's really important. And we're just trying to hit like as many different people as possible. So just the general public has a chance to weigh in. But then also people at like the county or city staff level that would be implementing programs, and then our elected leaders as well. Because for me, I think that's something that you can sell as a program. I'm trying to improve community well-being. And in particular, we've got this one score that's really low. and this is what I think we can do to improve it. And that's something that you can really like attach to governance in terms of, proving that you're doing something on a community-wide level.
Right. So, well, I think you're off to a good start. Coming out of a pandemic.
All right.
Coming in the spring. Mm-hmm. You got the Happenings magazine, the Billboard. We got you on the show today.
Right.
So where do they go to get involved?
You can go to valleyinmotion.org. And you can
sign up there.
Yep. Yeah, there's a Get Involved button. There's a Blue Zones page. So
it tells you everything. Yep. I've been on the website. I think it's great, and I was glad that you came on.
Okay.
Anything you'd like to add before we?
No, just thank you so much for having me on.
Well, it was great to have you on, and I look forward to seeing how this goes. And I know it's going to improve everybody's quality of life. And I said from the beginning, we're starting to grow here again.
Right.
You know, I think we're going to move forward.
Right.
The city's moving forward. Our
Right.
region is going to move forward.
Right.
So we're in a good spot. We have only up from here. So
Good.
It's all great. But I really appreciate you coming on.
Okay.
Thank you very much, and I look forward to seeing you around town.
All right. Good.
Thank you.
Thank you.
All right. Well, I'd like to thank Gus for coming on, talking about Valley in Motion. We discussed blue zones, the valley murals that are going up around the area, and the iron furnaces and the improvements that they're looking to do in that area. All to improve our quality of life and hopefully make life just a little bit better around here. So I'd want to really thank Gus for coming in. I appreciate it. Remember, if you like this episode or any of the other episodes, you'd like to donate, this is all paid for by the friends of Chris Chermak, so all donations are certainly welcome. Next week, we're looking forward to visiting with Jason Kavulich, and he's from the Lackawanna County Area Agency on Aging. So we're going to talk about all the things that are going on in that department, along with the COVID-19 vaccinations that are going on, and just all the different things that goes on with area on aging. So look forward to that. So thanks for tuning in. We'll see you all next week.